Hello, I'm Dr. Phyllis Schiffer-Simon, the General Manager of Becon TV, and your host for this program. On this community forum, we'll be discussing the life-saving work that the Transplant Foundation is doing for our community, including recipients within the South Florida area. This includes not only organ transplants, but also counseling for the patients and families, as well as organ donation and transplant research. My guests today are James Konschnik, CEO of the Transplant Foundation, Josh Lenton, Program Manager at the Transplant Foundation, and Teresa Bueno, Clinical Manager of the Mechanical Circulatory Support and Heart Transplant Program at Memorial Regional Hospital. Welcome to all of you.
Thanks for having us.
James, let's start with you. Tell us about the Transplant Foundation and the role that it plays in our community.
Well, the Transplant Foundation is 25 years plus old. It was started back in 1987 by a group of transplant recipients who wanted to do more to create awareness for the organization and for our community. Today, we serve the state of Florida, not only from a patient services perspective, but from our mission. Our pillar is patient services, education, and research.
Okay, and tell us just a little bit about your role with the Transplant Foundation.
Well, I'm currently the CEO. I just celebrated my 1-year anniversary with the organization. I'm proud of the work that we're doing and that we're taking our mission and our awareness campaign statewide.
And we're going to talk a lot more about why the education is so important for our community. But let's also meet Josh. And Josh, you also work with the Transplant Foundation. Tell us about your role.
Yes, I've been with the Transplant Foundation for about 5 months now. I am the programs manager. I oversee all of our education programs, as well as our community outreach, as well as our lecture series, just to get our name out there, as well as educate people on what we do and organ donation and awareness. Okay,
we're going to talk a little bit more about your experience with transplants, and we're very happy to have you here. Teresa with Memorial Hospital, tell us about your role and what you do at the hospital.
I am the clinical manager for the Mechanical Circulatory Support Device Program and Transplantation at Memorial Regional Hospital. My role is to take care of the transplant candidates, to ensure that they get their workup so they can become listed for transplantation, and then overlook their care after the transplant as well. I work in conjunction with a multidisciplinary team comprised of cardiologists, surgeons, nutritionists, social workers, psychologists, and pharmacists, and that allows us to provide comprehensive care to our transplant candidates and recipients.
Okay, and I understand that there are kind of 4 phases of when somebody is identified as a possible transplant recipient. Tell us about that.
The key to success for transplantation is early referral. There are 4 phases of transplantation. That the first one will be the referral and evaluation. During the evaluation phase, the candidate undergoes testing to determine that in fact it is a suitable candidate, that the person is a suitable candidate. Once that's completed, we proceed with listing. That is the second phase, and the waiting phase. The waiting period is unpredictable. It's based on acuity of illness and also blood group weight, and many other factors come into play with that. The third phase is actual transplantation, and the fourth phase is the post-operative care and the follow-up. The patients can be referred to the Transplant Foundation at any point in that period of time.
Okay, thank you for sharing that, Teresa. So, James, there's a holistic approach here, is what I'm hearing from the Transplant Foundation. So some of the services that you might offer, let's talk about the scope of those and how they help people at any phase of that process.
Well, the majority of our services are patient-related, and the monies from our license plate, because we're the only organization with the organ donation license plate in the state of Florida, and the funds from that are designated by the state of Florida to be used for education, research, and also patient services. And when we refer to patient services, that means that if you're pre-transplant or you're post-transplant and you're having trouble paying for your medical copay, for medication, for whatever it might be, we're there to assist financially to get you back on that road to recovery. just as an example, one of the things that we did provide, there was a young recipient that needed special formula to provide her the nutrition after her transplant. Because of her age, she was not an infant, but it was infant formula. So the insurance company would not pay for that very medically needed formula. So the parents wrote into us and submitted a grant application, and we were able to provide the funding that they needed to give her that much needed formula.
Okay, so I mean that's just one example, I'm sure, of many different ways that the foundation helps support transplant recipients before and after their transplants. Let's talk a little bit about need, because we want to educate people that there is a need for people to become donors and understand more about the transplant process. But what is the unmet need as it stands today?
Well, right now in the nation, there's over 122,000 people waiting for an organ transplant of some sort. Here in Florida, there's over 5,500 people waiting for some sort of transplant. And the disparity is that there are not enough organs, and that's why those people are waiting. And that's part of our mission, is to educate folks to become an organ donor. And that's why it's so important that everyone considers donating their organs in whatever fashion that they decide, because you do not need to donate all of your organs. You can choose either to donate all of them or a particular one. So people just need to become more educated about them.
So there's a lot of choice involved with
Yes.
that.
Absolutely.
Okay. And one individual can save how many lives if they do, let's say they decide to donate all their organs to help other people? How many people can be impacted by just one individual?
Well, many people can be impacted, but eight recipients can receive life-saving organs.
Okay.
Sadly, about 20 people die daily waiting for organ transplantation.
So we're kind of in a critical situation where, we don't have the number of organ donors needed to save the lives, but just one person can save the lives with those critical organs of 8 people, so that's very, very significant. All right, so Josh, if you would, tell us a little bit about your history. You are an organ recipient, a couple times actually.
Yes, I am a 3-time heart transplant recipient, all before the age of 12.
Amazing. Okay, so tell us a little bit about that experience.
Well, I was born perfectly healthy at 10 days old. I was diagnosed with what is called tetralogy of Fallot, and ended up receiving 2 open heart surgeries, a pacemaker, and by the age of 3, I was given my first heart transplant. I was then healthy for a year and a half when I got my second heart transplant, then went on for till 2001, 6 years. I received my third. I was just about to graduate elementary school, and before then I had already experienced more things than people do in their entire life: cardiomyopathy, coronary artery disease, heart rejection. And then when I was 15, I was a sophomore in high school, I was diagnosed with what's called PTLD, post-transplant lymphomatic disease. And it is a rare form of cancer that you can receive after getting a transplant. Just because you have a transplant doesn't mean that you will get the cancer. I, as you can tell, just like to make my parents' life difficult, and made sure to get that. But I was clear of cancer a year after, and here I am at 25.
Okay, well, and thank you for sharing that story. I mean, you look great and seem very healthy. And so it's understandable that you have a passion for working with the Transplant Foundation now. Is that, is that really what you feel you need to do to kind of fulfill your own needs and objectives, because you have received from the transplant community?
Yes. A lot of it has to do with, going through it myself, as well as when I was in college, I lost my friend who I met through getting a transplant, and he was diagnosed with the PTLD as well. He lost his life, unfortunately, and ever since then I've made it my mission to make sure that we do everything we can to, make make people healthy and aware of organ donation, amongst other things.
Okay, so and you certainly have some individuals to have gratitude that they were organ donors, because you're a third-term recipient.
Yes.
And it's great to have you on the program.
Thank you. I'm glad to be here.
So let's talk a little bit about, if people are interested in learning more about organ donation or desire to be a donor, what would they need to do?
Well, it's quite simple. Just visit our website at transplantfoundation.org. There is a way to sign up. You can also go to the Organ Registry website. We're out in the community all the time. You can also sign up that way as well to be an organ donor. The easiest way to become an organ donor is to put it on your driver's license and elect to do that. There are a lot of facts and a lot of fallacies out there, and false ones, that if you do become an organ donor, there are certain things that may happen, so that it is precluding a lot of people from becoming an organ donor. But we're out in the community trying to break down those barriers and stop those myths.
Yeah, and let's talk a little bit more. Are there some religious or cultural myths about organ donation specifically that we can address?
Well, culturally, both for the African American and the Latin community, which is critical here in South Florida, there is a lot of beliefs that it's just it's not healthy to cut up the body, and it's just, we're trying to break down a lot of those, and people don't talk about it. That's the other myth. You just don't talk about transplantation at all, whether you need it or not. And the African American community is the highest population for the need of transplant. So it's kind of a catch-22. We do need to educate that community. But also there's a lot of religious myths as well. And every organized religion in the world today believes in organ transplantation.
Absolutely.
Well, because we're saving lives.
Mm-hmm.
And I would think that that if a family lost a loved one, it's a way for them to do something very positive, where that loved one kind of lives on, because it's enabling the life of somebody else. So life after transplantation, well, you've certainly had, your share, but are you restricted in activities? How often do you need to have yourself checked? And are there, other things that you deal with that other 25-year-olds might not?
I think I'm kind of an exception. I have no restrictions. I do everything a normal 25-year-old does. There are people that unfortunately do have some restrictions. It's kind of how your body reacts to it, and how healthy you are. I was lucky enough after my third transplant to be back playing Little League Baseball 3 weeks after my transplant, because growing up with transplants, it's all I know, so I'm not going to prevent it from doing anything that I want to do. I do get checked about twice a year. I go for a heart catheterization twice a year. I actually just saw Teresa and her team a couple of weeks ago. Now that I live down here in Florida, I stop at Memorial to make sure everything's okay.
Well, that's great. That's great. And you really are a true testament to the value of people being more educated and the willingness to save lives. So, Teresa, I understand Memorial just did their first heart transplant. Tell us about that.
Yes, September 13, 2014, Memorial Regional Hospital made history. We conducted the first adult heart transplant in Broward County, and we're very proud of that. Our patient was gravely ill prior to the transplant, and we were able to nurse her back to health, and she's now home enjoying her children. And we see her frequently just to ensure that everything is moving in the right direction. But we're very, very proud of our team and our accomplishments. Our main goal is to serve our community. There was a great need for a transplant program in the Broward County area. So we're very proud of being able to bring that.
And had this individual not received the transplant, the outcome could have been very different?
Absolutely. The outcome actually would have been dismal because she was gravely ill. It was almost a miracle that we received that phone call on September 12th, and she received the transplant the following day on the 13th.
Well, I'm glad to hear that she's doing so well.
She's doing fantastic.
So let's talk a little bit about who or what other organizations that you partner with in terms of providing the holistic services for the transplant community.
Sure, we partner with national organizations, but mostly here in Florida. We partner with the National Kidney Foundation, the American Lung Association here in Florida.
We also partner with Donate Life Florida, as well as all 4 organ procurement organizations. The organ procurement organizations, or the OPOs, as we like to call them for short, are the ones that actually go around and approach people at the hospital with, asking for the organs to be given.
Okay, and what role does the family play in that? So if somebody wants to be an organ donor, can the family, the family should be supportive, obviously, but it is a kind of a family decision?
I always like to educate everyone that I encounter that it's very important that they make their wishes known to their family members. If they like to be organ donors, it's very important that they make their wishes known, because at that moment is the family that makes that important decision. And as I mentioned before, that can impact eight people, that can give 8 individuals a life-saving organ.
And you can also determine which organs
Absolutely.
you're interested in. So I understand that there are some notable people or celebrities that have received transplants, like you, Josh. Who are some of those people, and what type of transplants?
Well, like as you said, transplant affects everybody. It's not just the everyday person. Mickey Mantle received, I believe, a liver. George Lopez and Tracy Morgan are recipients as well. Eric Compton, who we work closely with, is a heart transplant recipient, and he's a professional golfer, for those that don't know. And obviously big down here in South Florida, Alonzo Mourning, getting his kidney, I believe it was. So those are just a few names, but organ donation affects everybody.
And obviously those folks would be encouraging others to learn more about the whole transplant process and how people can be donors.
Yes.
Okay, and that's why we're here today. Yes. So if I'm interested in learning more about the license plate, I'm not sure I want to be a donor, I'm going to kind of think about that, but I might be interested in learning more about the license plate. That's one way to help and give, because it's providing support.
It's also providing awareness 365 days a year, being
True.
on your car.
True. And the proceeds from the license plate go to the foundation.
Correct.
Okay. And what other ways do you raise money? You have the license plate, you have partnerships.
We have partnerships, we have corporate donations, and we also have special events. We just hosted our annual golf classic.
And we also have our annual gala coming up in soon, early next year, as well as our walk in the beginning of next year as well. Those are our main fundraising efforts besides our license plate. Our license plate, as Jim mentioned, is always out there and aware, but we are able to get a ton of people coming to our gala and our golf event as well as our walk, and get a good sized crowd to get our mission out there and get organ awareness out there as well.
All for a good cause. So what percentage of individuals who receive organs receive them from a family member?
There's a living related donation program for kidney transplantation, and also that's available for liver transplantation. But also that has to go through the matching process. So not everybody that tests is a suitable donor for that particular recipient. So it's a lengthy process, but it's definitely an option, and it can definitely shorten your wait.
So let's talk a little bit more about the matching process. So somebody may be a match, but how does that really work? It's through testing?
It's through blood testing. We have to make sure it's the appropriate blood group, it's the appropriate antigen match, and that there are no antibodies that might cause organ rejection, depending on the organ.
Okay.
And
so there's some transplantation that, or organs that people can donate. We have a colleague here at Becon who received an organ from a family member, and they're both doing great. So, you can both be thriving and still help another person.
Absolutely.
But you don't necessarily have to be a family member, because sometimes those matches I'm sure there's a lot of criteria for the matches from a biochemical standpoint, and not rejecting, but you can be a match, just a random match.
Absolutely. There is a process to do testing, and you do not have to be a family member to donate, say, a kidney or even a portion of your liver.
Now, from a priority perspective, once somebody is eligible, they've gone through the first phase, and they're eligible, and they're waiting. How are the individuals prioritized, and how does the notification happen? I know you can get a call at 2:00 in the morning, but how does that all work, and who's facilitating and coordinating all of that?
Okay, so the waiting is the toughest part of transplant, because you never know when that is going to happen. I've had patients be listed for a day and get the phone call, and I've had patients listed for a year and get the phone call. So patience, it takes a lot of patience, and trusting that your organ is going to come at the right time. That phone call is the most amazing phone call I have ever made, and I'm sure the most amazing phone call that the recipient receives. It usually happens, you're correct, sometime in the middle of the night. And, everybody, usually it's very eager and just anxious to get the process going.
Now, has Memorial done other types of transplants? I know the first heart transplant was just performed a few months ago, but has Memorial been involved in other transplantation?
Yes, actually, Joe DiMaggio has been doing pediatric heart transplants since 2010. They've conducted 18 heart transplants to date, and we actually had our second heart transplant on September the 22nd, almost back to back.
Oh, wow.
And again, both of our recipients are doing remarkably well.
Okay. So, Josh, back to you. Anything else you'd like our viewers to know about the importance of educating themselves, considering supporting the foundation through license plate or donations, and ultimately being willing to be an organ or transplant donor?
Well, I think the most important thing, besides getting the license plate to help promote it, is educating yourself, as we've been talking about, just so you know exactly all the myths being busted, as well as how you could help somebody. I mean, as we've been talking about, I'm a testimony to how important it is to help donate a life. If nobody knew about organ donations or the hospitals weren't there, I would not be here to give this interview, and none of us would even be here to do what we're doing. So organ donation, while it may sound scary, but as some material that we have in our office says, leave your organs here. God knows we need them, or it's something along those lines. But it's very important to make sure that you could help somebody out that is in the need.
Okay, that's great. That's great. And so, what are the goals? So, the organization has been in existence almost 25 years.
Yes.
And so, what are the goals for the next year or so? Raising awareness, obviously. But we've got over 5,000 people on a waiting list here in Florida. Mm-hmm. What, from your perspective, what would a successful outcome be?
Well, I think it's multifold, because we've been in existence for 25 years, but it was just in the last year and a half that the board had decided to go on a statewide level. So it's really getting the word out, being out in the community, promoting the license plate, but being out in the community in pockets where it can impact the amount of donations that are being made, organ donations I'm talking, and getting people involved, training people to be speakers on our behalf. With a staff of 5 for the entire state of Florida, paid staff, volunteers are critically important to us, and we can't possibly do everything around the state ourselves. So volunteers are critical.
So there's many different ways to help.
Exactly.
And Teresa, any parting words, because we're almost out of time, from you that you'd like to share with our viewing audience?
Yes, I just wanted to say thank you to the Transplant Foundation for certifying the transplant mentors, because that's a very important program that helps our transplant candidates and recipients through the transplant process.
And how are the mentors trained, or do they have to have a background in receiving a transplant?
Generally, they are transplant recipients, and the Transplant Foundation set up an actual program to train them and give them the appropriate credentials so they can help other transplant candidates.
Okay, that
and
mentoring
recipients.
Probably is very, very important because somebody has walked in those shoes.
Absolutely.
Okay, well, we are out of time. I would like to thank my guests, James Konschnik, Josh Lenton, and Teresa Bueno, for making this community forum discussion possible. We hope that you, the viewing public, will educate yourselves more about organ and tissue donation. Together, we can make a difference and save lives. I'm Dr. Phyllis Schiffer-Simon, and you've been watching Community Forum. Until next time, I hope you'll watch more Becon TV and learn something new today.